And you talked about delivery, and you've done a lot of work on improving delivery mechanisms.
Yeah.
What has that work been like, and how has it been changed? Are there really new delivery mechanisms that we can find today, or do we have all of the tools at our disposal?
Well, I think there's a tension in delivery now that we're coming to grips with in public health. And that is that I think we all see that the ideal system is something like a routine health center that's well staffed and operating well with drugs that people can go to. In fact, if you look at what's actually taking place at delivery, particularly in the difficult areas, it's actually maybe different than that. It may be campaign outreach, or community health workers, or a whole range of alternative delivery services, particularly in the difficult areas. And so we have to ask these questions where we're unable and unsuccessful at building out routine delivery services. How then do we account for that? Do we double down on our investment in routine services, or do we take advantage of the system that already exists? An example, in northern Nigeria, a DHS survey just came out which showed that in several of the states, vaccination coverage would be 1 in 4 children might be vaccinated. And yet those children still have monthly polio campaigns that they have, which achieve much higher coverage than are seen in the routine system, although often not great coverage, but still much higher. And the question is if we want to reach those children with other services, other vaccines, services for preventing diarrhea, for treating pneumonia, what do we do? Do we continue to double down on building out a routine system, or do we take advantage of the service delivery system that already exists? And how do we match that up, and how do we justify that? I think that's the dilemma that we're facing in global health now.
And how do you make that determination? Is that a sort of a silver bullet decision across the board in different countries that you can make, or what goes into that decision?
Well, this is where the partnership comes into play. And it's certainly not people like me who make that decision. I mean, we can collect information and tell stories and try to do analytics around this, but these are our local decisions, and these are local decisions with the delivery partners who have to struggle with this on a daily basis and understand the implications of that. These are not implication-free decisions to choose one way or the other, and often they might, you see it as a zero-sum game, then one needs to account for the choices that are not made. So I think there's a role at the global level for understanding the finance and the economics, the analytics around that, but certainly there are a whole range of other issues which can never be appreciated at the global level, which need to go into the local decision around this.